It's obviously quite early on, being that we've really rolled this out since January this year, but we are already starting to have some tremendous feedback from other services who work with patients following the ambulance service being involved with people at that point of overdose. And so far it has been very positive feedback that we've received. I think people, community members who are using substances just feel that us approaching them with a naloxone kit says that we care about them, we want them to survive, and I think that stigma is going to start to change, and that's where we're going to really see some partnership working with ourselves and the community members.
The difference this year has been that we've managed to get a supply of naloxone from the Taskforce, so we're able to give it out in the community as well as being trained to use it. It's made a huge difference having it available. We've been able to give it out in the community, but also we've been able to save lives in the community. I got a phone call from somebody in my area who knew I had naloxone, who knew I was trained in naloxone, and one of his friends had fell into an overdose. So we attended there and we managed to help. But having a naloxone there's made a huge difference.
So of course the ambulance service will deal with overdoses. It's a medical emergency. We get there and we do what we need to do in terms of making sure that person's safe and well from a physiological perspective. However, people who have issues with substances, there's a lot more going on in their lives than just that. We're now making it a priority for the ambulance service to look at ensuring that we can connect patients to the relevant support and treatment services, using take-home naloxone, for example, as a tool to maximise the discussions and opportunities to look at what that patient needs above and beyond just that medical emergency at that moment in time. How can we make sure that we can connect them to a support and treatment service to get the best possible care that they can following that particular incident?
What I'd found when I was talking to a member in my community was he'd been using benzos, street Valium, and he didn't understand what he was taking. He'd been taking the dangerous Valium, and because of the colour, it was a white one he took, and he thought that was a lower strength. What concerns me about that is that drug users aren't educated enough in what they're taking. Although they're told, I think it needs to be drummed in more and evidence shown to them, rather than just a clinical person saying to them they're dangerous. It needs to be more spoke about. The stigma needs to be reduced, and we need to educate the drug users on what they're taking.
So coming up to International Overdose Awareness Day, one of the messages that we would like the public to be very aware of is how to communicate with a call dispatcher when you phone for an ambulance, when you recognise that someone is having an overdose. If you can communicate that you recognise symptoms of pale skin, like poor breathing, or like hearing that sound of snoring, starting to notice someone's lips going slightly blue, if you can portray that and advise them this could potentially be an opiate overdose, our call dispatchers will actually talk you through how to use your naloxone kit, how to put it together, how to administer it, and they'll keep you calm and collected while the crew are on their way to then come and support you further.